So we've been getting a ton of questions about how does our weight loss program work? And this video is going to explain to you exactly how you're going to drop the weight that you've been struggling with for the last ever. First of all, the few things that we do use in our program are both semaglutide as well as Lumen. Lumen is the device that does metabolic tracking and teaches you what are you metabolizing, carbs versus fats. Kind of the same thing that you wear the scuba diving situation on your face and you go on a treadmill in a facility and it tells you what are you doing. Are you doing CO2 versus O2? It's the same thing, just a tiny little device. You blow into it in the morning and that's the end of the story, and it tells you if you're metabolizing carbs or fats. It also comes with essentially an educational program that tells you exactly what to eat, how much macros to eat, and with time, it teaches you how to be metabolically flexible, meaning switching carbs versus fats. Semaglutide comes into place in order to decrease your cravings for food if you're struggling with things like binge eating or just snacking from boredom or any of the above. Semaglutide, what it does essentially, it decreases your cravings and decreases your kind of desire to eat overall. So between the two, it really teaches your body how to be a lot more effective with metabolizing what you're putting in, teaches you to exercise, and simultaneously gives you a little bit of that oomph that you've been missing in order to decrease your cravings for food. In addition to that, every time you come into the office, which is every 4 weeks, you come in, you get into a special scale. The special scale tells us how much weight you dropped, what's your muscle mass versus what's your fat. And we keep tracking it in a way that you will be dropping fat and not muscle, because that's one of the biggest issues that we see with semaglutide, is that people drop way too much muscle. So this way we're going to be tracking what you're doing and avoiding you dropping too much muscle, which is going to drop your metabolic rate. In addition to that, that's going to drop your bone mass. So we're going to prevent it. The other things that I hear about semaglutide specifically is that compounded pharmacies having a ton of issues or side effects associated with people drawing too much from the vial, not knowing how to administer, and things like that. The way that we do this to avoid those issues is that we get semaglutide that is not compounded, meaning it is not mixed. It comes directly from a manufacturing facilities that provide pure semaglutide. We mix it with sterile water here in our office and give you 4 already pre-drawn syringes so you can go ahead and use them once a week as an injection. Come here at 4 weeks, get your checks, get on a scale, we'll talk about what your struggles are, and send you back home with additional 4 vials. So that's basically the process. And then you drop all of these fantastic pounds that you've been struggling with forever. How soon do I see results? Well, I've seen some people drop significant amount of weight within a first month. So it all depends on you. This is not designed to be a crutch. This is designed to be as an assistance for you to exercise, do weight-bearing exercises to not drop muscle mass, as well as eat well and healthy, limited amount of carbs, no junk food, no cheesecake in the middle of the night, etc., etc. Side effects. Let's talk about side effects of Lumen. Guess what? There's none. With semaglutide, it's a little different. Semaglutide is contraindicated for people who have had a personal or family history of thyroid carcinoma. There is also personal history of multiple endocrine neoplasm syndrome type 2 that is also a contraindication for semaglutide. If you have had a prior reaction to semaglutide, if you have a history of pancreatitis, diabetic retinopathy, and hypoglycemia. Also, you cannot be using insulin simultaneously together with semaglutide, because that will increase your risk to hypoglycemia. You ideally also will not have a history of acute kidney injury, bowel obstruction, of gastroparesis. The side effects of GLPs include worsening mental health symptoms. The reality is that many times people do already have mental health symptoms. That's the reason they come to us, and weight loss is only part of what we do in order to support people in their mental health journey. But unfortunately, sometimes mental health symptoms can return as you're starting to use semaglutide. So of course, suicidal ideation is one of the things that can happen. In that situation, as always, call 911, proceed to the nearest emergency department. If it's not that overwhelming, call me, we'll talk about it, we'll make adjustments. It can also worsen depression and have other effects on mood. The other thing that we need to worry about with semaglutide is hypoglycemia. So signs and symptoms of hypoglycemia are going to be slurred speech, sweating, drowsiness, shakiness, fast heartbeat, etc. Most common side effects, however, of semaglutide typically include GI symptoms, gastrointestinal symptoms such as nausea and constipation. Typically, those resolve within the first month. If you do have too much nausea, we can always give you Zofran or ginger juice, so that's typically not an issue. For constipation, you can always use over-the-counter things like Metamucil and magnesium. That's really it in terms of the side effects. You do have to worry about pancreatitis, and that will typically present with abdominal pain and gastrointestinal symptoms. So what we do to assure you're not developing pancreatitis is, number one, don't drink a ton of alcohol. Number two, we check your pancreatic enzymes every about 2 months, so every other time that you come into the office to refuel the semaglutide. Let's see, you can get dehydrated with it, so you really need to make sure that you're drinking at least 2 liters of water with it, and you're also advised to have high protein diet. So a combo of dehydration and high protein diet can essentially damage your kidneys, and that's why we also check your kidney function every 2 months, and we are sure that you're drinking plenty of water. You also want to watch for things like dark urine, etc. Hypersensitivity reaction, allergic reaction, which is going to be effective with any medication, and that's it. We also going to worry about cholelithiasis or cholecystitis. And that's going to present in pain in your upper abdomen, yellowing of the skin, fever, or clay-colored stools. That's it. If for some reason you OD on them, you gave yourself an extra injection, typically it's just going to worsen the side effect symptoms. If it's too much, you proceed to the nearest emergency department. If you miss a dose, not a big deal. You can go ahead and give it to yourself within 5 days of the initial dose. The last question that we had was, does it work well on medications? And the answer is absolutely. The way that we use integrative psychiatry approach in order to treat human as a whole is we address things with mental health, specifically with psychiatric drugs. Very often we do blood pressure medications or whatever it is appropriate to you with your particular symptom presentation. Simultaneously, we're treating underlying issues like vitamin D deficiency, vitamin B deficiency, maybe low T3 syndrome, presentation of hypothyroid, low testosterone, perimenopause. All of those things are also treated while simultaneously managing your weight with semaglutide, Lumen, etc. That's really it. If you have any other questions, let us know, and I can't wait to see you in my office. Bye, guys.